So let me talk a little bit about the dosing. Again, it's varied. Very wide suggestions on dosing, but basically they're saying 1 to 6 milligrams per 10 pounds of body weight. That's the dose. That's a pretty broad range. So if you weigh 100 pounds, you can take anywhere from 10 milligrams up to 60 milligrams. Take it, 2 or 3 times a day, perhaps. So if you're, a 200-pound person, you can take 20 milligrams up to 120 milligrams. And when you look at the recommendation, a lot of these products, well, you start with a dose and work up until you feel relief. So sometimes in the healthcare world, you'll hear about a new medication or a medication that's being prescribed, and the doctor will start low and go slow. And that's a practice sometimes for certain medications. Begin at a low dose and slowly increase it till they become effective for the individual. The same case here with the CBD. It's quite a wide range of doses, but basically it's 1 to 6 milligrams per 10 pounds of weight. That's quite a stretch. But that's a starting point. Again, the individual has to decide what works for them. So I mentioned that it was available in a lot of different ways, right? From drops to tinctures to sprays to topical products, suppositories, vape juices, many edibles, lots of things. So when we take it, when we ingest it, when we apply it, it's going to work in a variety of ways as far as getting into the body. So of course, the quickest way for it to work would be through inhalation, right? So if someone is going to get the vape juice and use it through a vaping pen, they're going to see results in 1 or 2 minutes. I mean, it's quick, right? Directly into the bloodstream, and away it goes. It's starting to work. Might last for 2 or 3 hours, that particular dose, but you need to take less of it. The dose can be smaller because it is going directly into the bloodstream. Another quick way to get it is under the tongue. So you put some drops or a spray or a tincture, something under the tongue. And then that's absorbed very quickly because very rich in blood vessels in our mouth. And so that is absorbed also quickly and gets into the brain. It may work in a few minutes. It may take more minutes, 5 minutes, 20 minutes, depending on the form that you're putting under your tongue, the availability of that product. If you think about nitroglycerin tablets, right? People dissolve nitroglycerin under their tongue in the case of chest pain, and so it does work quickly. Again, because it's more rapidly taken into the blood, it may not work as long. So might be a shorter duration, but again, it's going to allow you to use a lower dose because it's getting a more direct absorption. If you take it by mouth, that obviously there's a variety of ways, right? You can get it in edibles, you can put it in drops, put it in your coffee, put it in a drink, however you might want to take it. Once it gets into the stomach, then it has to be absorbed. Then it goes through the liver because the blood goes through and called first pass effect. So some of the drug is going to be metabolized and cleared from the system. The rest of it will get out into the bloodstream. But as you can imagine, that takes longer. That might take 30 minutes, 60, 90 minutes for it to reach its onset and peak. And it's going to last longer. But you'll need a higher dose because of the slower absorption. And there's not necessarily all of it's going to be absorbed. It certainly could pass through our system before it's completely absorbed, or as it goes through the gut, it's going to be more slowly absorbed. So that's the downside to taking it by mouth, but that is also an upside that it will last longer and you'll get a longer effect as you take the medication. Topically, transdermal, right through the skin. You can put it on in a lotion and in balms and ointments and patches. Again, that's not going to be as rapid. It has to go through the skin into the area. And again, if you think back, I had mentioned there's receptors throughout the body. The CB2 receptors are there. So the CBD does get into the system, and it will go into those receptors and perhaps give some muscle relief, some ache and pain relief. but it's going to take a few minutes for it to get there, several minutes. And again, it can be a longer acting product because it continues to be absorbed into the skin. But this is not really going directly into the blood supply, right? It's locally perhaps, but it's not enough of it's not getting into the blood as it would if it were vaped or sublingual or even by mouth.